in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
PTO 4 minutes.
By road
It's a shooting of a male currently being shot ahead.
and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
This is going to be tight and painful, OK, but it's going to save your life.
day and night.
All right, well done.
From car crashes to stabbings.
He's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear?
Shocking.
Yep.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we are going to be cracking open the blood products en route.
Female casualty.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight,
Is that your head, buddy?
a boy riding his bike collides with a bus.
We've got some distension to his umbilicus region, and he's complaining of left pain in his proximal femur.
A man is struggling to breathe after being rescued from a house fire.
Can I just have a look in your mouth? Okay, he's got quite a lot of soot in there.
A road traffic collision leaves a motorcyclist with a serious leg injury.
Ready, steady, and lift.
And a 17-year-old rugby player is knocked unconscious in a tackle.
Open your eyes, buddy.
On average, West Midlands Ambulance Service receives over 4,000 calls for help every day. At night, fewer people ring 999, but those that do are often in a serious condition requiring urgent medical care.
Just booking on, me and Rich Fawcett. Just give us a call if anything comes in.
Yeah, no worries, buddy.
While most of the West Midlands sleeps, critical care paramedic Kiri Hemus and Dr. Richard Fawcett are on standby to treat the most serious life-threatening emergencies.
How can I help? Hi, it's fire service here. Can I inform you of a house fire? Person's reported trapped. Do you know where the fire's located? Upstairs. And how many pumps have you got en route? 3. Okay, thank you. Thank you very much.
A building is on fire with reports of people trapped inside. 3 fire engines are on their way, and with the possibility of casualties requiring critical care at the scene, Dr. Richard and Kerry are also dispatched.
It's a house fire. Fire and rescue service have 4 personnel committed inside. 1 patient has been rescued from the building with smoke inhalation. Unknown if there's other patients inside the property at the moment.
Hi, Delta 98, that's all received. The update that we've got is a 4-storey building, HMO property, so potential for multiple victims.
The building is classed as a house in multiple occupation, which means it's shared by many different households. So far, 1 casualty has been rescued.
If he's had to be pulled out of a burning building, then it could be that he could deteriorate quite quickly. I think that might be a fire engine, actually. It sounds like it's going to be a hectic scene.
I think it's up there.
My Delta 98 on scene.
Having been rescued by the fire service, 1 patient is receiving oxygen in the back of an ambulance.
Hi, John. My name's Richard. I'm one of the doctors here. Are you in any pain at all?
Yeah, and the back of my neck because they have to drag me along the floor.
More from being dragged down, not from any burns, no fire. Did you actually see any fire in where you were?
No, just pitch black smoke.
52-year-old John was found in his bedroom on the 4th floor of the building. A candle he was burning started the fire.
Did you pass out at any point?
I don't think
No? You got any breathing problems normally?
Yeah, I've been in hospital with a chest infection.
Okay, when did you get out of hospital?
We went in on the 6th of October.
Oh, okay.
3 days in ITU.
Oh, right.
John recently left the ITU, or intensive therapy unit, where he was receiving treatment for a chest infection. As he's already recovering from this serious condition, his lungs are particularly vulnerable to smoke inhalation.
So today, before the fire, have you been feeling okay, or have you been under the weather?
Tired.
Do you feel like your throat is tight or anything?
It just hurts.
Just hurts. From the fire or from where you were dragged?
I'm tired, just right.
Inhaling smoke from a house fire can result in heat damage to the upper airways, as well as poisoning from the toxic chemicals given off by burning furniture.
Just going to listen to your breathing, all right. Can I just have a look in your mouth? Okay, he's got quite a lot of soot in there. So, a lot of airway singeing in the nasal, a lot of carbonated sputum at the back. Would you like some painkillers? It's all right if we pop a little line in you and give you some IV stuff.
Okay. My name is okay.
From what we've heard, you were the only person in that needed to be brought out. So as far as we know, everyone else is okay, John, all right?
There are 8 flats in the converted building where John lives, and every resident needs to be accounted for. "33 minutes after the alarm was raised, news comes in that a second casualty has been pulled from the smoke-filled building and is now in need of Dr. Richard's care. At RAF Cosford, the headquarters of Midlands Air Ambulance, critical care paramedic Ian Locke and Dr. Matt Newport are preparing for their shift.
So red bag, green bag, blue bag, Lucas, blood. Got drugs. Ultrasound, I've seen. Have I seen ultrasound? Yeah. Or am I just, yes, am I just telling myself I've seen ultrasound? Yep. Cool. Jace.
Ambulance services, patient breathing?
Yeah.
Is the patient awake?
He's slipping in and out.
Right, how old is the patient?
He's 17. Let me just pop you onto the club chairman, 1 second.
Hello?
What happened?
He took a bang to the back of his head during a rugby game. And when he tried to get to his feet, his legs went and he's gone down again. Sorry, 1 second, I'll just pass you on to his mum.
Hello?
Did you see what happened at all?
I didn't, but one of his friends said that he was took out quite bad, I think, and banged his head, I think. The kid's going into consciousness.
No, he's gone again, he's gone.
He's gone, Bab, he's gone.
We are coming as quickly as we can.
03, lifted, 13:27, run time's 5:05 minutes, over.
Almost half of all sports injuries needing hospital treatment are children and adolescents, with rugby being most associated with head injuries and concussion in boys.
He responded to reports of a 17-year-old male at a rugby club. Injury to head and unresponsive. Ambulance crew are 2 to 3 minutes out of it.
An ambulance has been dispatched, but there's a chance the boy could need an urgent brain scan. So the air ambulance with Dr. Matt and Ian has also been scrambled.
So this is at the rugby club itself?
Yeah, at the rugby club, yeah, head injury, 17-year-old. So with a bit of luck, there'll be some big green space and we can make a safe landing.
Helimed 03 takes just 5 minutes to cover the 10 miles to the location.
Yeah, they're still playing.
Yeah,
So the pitch, which is on the western side of them,
yep,
is probably going to give us better access to the car park if you do need to wheel him to us.
Yeah.
And I'll try and land it adjacent to the trees if you're happy with that. Landing on.
When they get there, the boy has already been moved to the changing rooms and is being treated by an ambulance crew.
Are you Mum? Mum, I'm Ian, this is Matt.
17-year-old Cole was on the receiving end of a rugby tackle in which he was knocked unconscious.
Tell us the story.
The ambulance crew give an update on his condition.
and he's gone unconscious. They're saying he's gone unconscious just for a split second. He's complaining of head pain at the minute, and he's panicking a little bit.
Yeah.
We're just trying to get access just for the pain.
Cole, open your eyes, buddy. You can open your eyes, mate. My name's Ian. I'm one of the guys come to check you over. You're okay, mate. Just open your eyes, buddy. You guys all right if I just give him a quick top to toe? Is that all right? Yeah. So he was tackled and then he fell to the floor and hitting his head on the ground. Is that what we think? He's been kneed to the back. He's had a knee to the back of the... Oh, okay. Good compliance. Feels intact. Just straighten this leg out, buddy. There you go.
Relax. You're fine. Do you want the mask off for a minute?
I think we probably could, can't we? Yeah.
Take this off for a sec.
Cole is now conscious but confused, a sign that he may have suffered concussion, a traumatic brain injury that affects the brain's ability to function normally.
All right, lie down.
Cool. There you go.
But where's the pain? Tell them where the pain is. Tell them. Come on, tell them where the pain is.
Preparing for another 12-hour shift are critical care paramedics Mike Andrews and Ryan Ferris. Mike used to train other paramedics, but in 2018 he joined the critical care team.
I feel like in 2.5 years of being on this team, I've probably dealt with more of the serious sort of cases, which is, you know, why we're here, understandably, than I ever did in sort of the previous 10 years as a paramedic. So,
like, I've got onto this team super early in my career, which is a massive privilege, and to think that potentially I've got lots more years within this team, it's just, yeah, it's fantastic.
Towards the end of their shift, Mark and Ryan are dispatched to their 4th emergency of the day.
Just speak update from the crew. So this is actually motorcyclist car.
A motorcyclist has been badly injured after colliding with a car.
Right, so we're going to Walsall. We're responding to a patient that's been involved in a road traffic collision. It's a crew request. The crew requesting CCP, enhanced care team support for a fracture. I don't know where the fracture is at the moment, but it sounds like an open fracture, so the bone's penetrated the skin.
The biker's injuries are serious and may require enhanced intervention, as there's a risk the broken bone could be cutting off the blood supply to other parts of the body.
If it is grossly misaligned, there'll be an awful lot of pain involved. The longer we leave it in a position where you're not getting blood supply to the foot, for example, the more likely it is that your tissue will become necrosed, cells will die, and they might have further problems with circulation.
The ambulance crew sent through another update.
He's conscious, but he has an open ankle fracture and significant swelling right the way at that bit to the hip.
Roger, mate. Yeah, that's all received, thank you. ETA about 6 minutes in.
It's a time-critical emergency. In the worst-case scenario, the patient could lose his leg. So Mike and Ryan's enhanced life-saving skills are going to be needed.
Just up the road from here. I'll stick my flecky on and have a quick chat to him, mate. Yeah, what's happened exactly?
This is Martin, okay? He was on a motorbike.
Yeah.
He's coming down the road. He's been hit by a car.
Yeah.
Over there.
59-year-old Martin was on his way home from work when he collided with a car.
I've removed his helmet and put a collar on because of mechanism injury.
The ambulance crew have cut off Martin's clothing to assess the extent of his injuries. Mike is updated on their findings.
Okay. So far, his chest, good rise and fall, no marks on his chest everywhere. I've exposed it.
Hiya, sir. Just having a look at your leg.
As Martin swerved to avoid the car, his left ankle took the full force of the collision and he's lost a lot of soft tissue from the area around the break. It's a serious injury and needs treatment at a major trauma centre fast. In Wolverhampton, Dr. Matt Newport and critical care paramedic Ian Locke are treating 17-year-old Cole.
I'm a bit shocked. bit dazed, a bit confused, don't worry. I think we'll get some access.
Cole was knocked unconscious in a rugby tackle and is now extremely agitated, a sign of a possible brain injury.
Sharp scratch, buddy, okay, just relax. Nice, slow, deep breaths.
Confused by what's happening, Cole's becoming increasingly anxious and is starting to hyperventilate.
Again, Cole, because you're breathing really fast.
I think because he's breathing so quickly, sometimes what you do is you flush a load of the carbon dioxide out and it just causes a bit of cramp in his hands and pins and needles. So we probably just, we can get a bit of pain relief in and just calm him down a bit.
Dr. Matt and Ian haven't found any evidence of broken bones or internal injuries, but suspect Cole may be suffering from concussion.
And well, I think probably, given that he's GCS 15, he's moving all four limbs, he's got good tone. I think head injury obs and a scan, both of which can be done at New Cross. I don't really see any reason.
Very sensible place. We can call them first.
Yeah, I think we'll give them details. Happy with that as a plan, roughly, for now?
With the pain relief having taken effect, Cole is now calm and fully conscious.
So we'll get a bed off, we'll get him on that, get him in the ambulance. I'll go and give him a hand with the bed and I'll update the sector.
As a precaution, Cole will be taken to hospital for further investigations.
When you're ready, mate, if you look over to your right, you'll see the ambulance trolley. OK, what we'll do is we'll sit you up slowly. We'll get you to have a little sit on there. It's a bit more comfy, bud, than this. Yeah. Do you want to grab hold of my arm? Do you want a hand up? In your own time, mate, all right? Here you come, buddy. Well done, mate, well done. 3, 2, 1. Excellent work. Have a minute, look to your right, Cole. Look to your right, mate, so you know where you're going. OK, let's get you onto that stretcher. Is that all right? Cole, you're all right, bud. Open your eyes, mate.
You can bend your knees up for me.
1, 2, 3, that's it, mate.
Stand nice and tall, mate.
I was never this big at that age, just not that big now. Cole, we're going to come out. You have to keep still, otherwise you'll bash your head on the door frame, bud, all right?
Dr. Matt and Ian decide Cole is stable enough for the ambulance crew to care for him on the journey to hospital, freeing them up for the next Code Red emergency.
All the very best, guys, OK? Cheers, buddy. He's got pain in the back of his head, and that's made him a little bit anxious and a bit sort of confused, given that he's had a brief loss of consciousness. And the plan is he'll go to the local trauma unit for sort of head injury obs and possibly a scan if he deteriorates at all. So hopefully this young man, will be fine, and I feel he will be. He'll have some time at hospital and hopefully come back and be playing rugby in the next couple of weeks.
This is the major incident pouch we're checking. So obviously for significant events where there might be lots of catastrophic bleeding.
The critical care teams were established to enable serious incidents to be treated at scene with advanced life-saving skills. Preparing for another shift is Dr. Michael Bright. Today he's partnered with paramedic Luke Chadbourne and nurse Rich Howarth.
That's all right.
Ambulance service, is the patient breathing?
Yes, she's just having an allergic reaction.
Is she awake at the moment?
Yes.
Has she got any rapid swelling to her face, lips, tongue, mouth or throat?
She can't breathe and we've just done the EpiPen for her.
And do you know what she's allergic to?
Yeah, nuts, all nuts.
Okay, there's an ambulance coming.
Thank you.
With a patient suffering a life-threatening anaphylactic reaction, this is a time-critical emergency. Dr. Michael and the team are immediately dispatched.
We've just been tasked to a 29-year-old reported anaphylaxis. The patient's reported to have taken their own EpiPen, so they must be known anaphylactic. Clearly, if they've called for an ambulance, that the initial treatment that they normally utilise hasn't worked or isn't working yet.
In a matter of minutes, anaphylaxis can cause swelling of the throat, leading to breathing difficulties. Without urgent medical attention, a severe attack could be fatal.
You have reached your destination.
In Shrewsbury, Dr. Richard Fawcett and critical care paramedic Kerry Hemus are at the scene of a house fire. 52-year-old John is suffering from smoke inhalation after being rescued from a burning building by the fire service.
Have you got your cannulas?
The fire started when a candle that John had lit set fire to his flat.
I'm going to go for a little one here, John.
While Kerry finds a vein to give him pain relief, Dr. Richard is searching for another resident who's also reported as suffering from smoke inhalation.
I just want to make sure this other guy, just get eyes on very quickly that he's not going to need anything.
So Ben's with him, he's very minor.
The incident commander points Dr. Richard in the direction of another ambulance crew member. They've been treating one of John's neighbours, who also escaped from the building.
He was in a flat above, so as they've walked down through the smoke, that's where he's inhaled it. So like, I'm not concerned.
Yeah, so he's got no obvious compromise. There's no carbonated soot or anything.
Fine.
Yeah, he should be fine for Shrewsbury. This other guy, I reckon we're going to have to get him up to the QE there.
Satisfied that the man and his flatmate are not in any danger, Dr. Richard is happy for them to be taken to the nearest hospital to be checked over as a precaution.
So John, what we're going to do is give you some painkillers, give you some fluids, all right, make you feel a little bit better. Do you feel sick at all? A little bit.
Back on the ambulance, though, Dr. Richard is concerned about the damage to John's airways.
I think especially because you only just got out of hospital with your chest as it is, what we're going to do is take you to a specialist centre that deals with burns, just in case you get a bit worse. You're already in the best possible place, all right?
Yeah, my neighbour's okay.
Yeah, everyone's absolutely fine. I've just been up there. You don't need to worry about anything. Everyone else is okay, all right?
First of all, John, we're going to run through some paracetamol.
While Kerry attaches an intravenous drip to provide John with some pain relief, Dr. Richard radios control.
Be leaving in the next couple of minutes with patient 1 heading towards the QE ETA approximately 50 minutes from now. Over.
Right, shall we go?
Yep.
Both Dr. Richard and Kerry decide to travel with John in the ambulance in order to continue providing critical care en route.
John, I'm just giving you something to stop you feeling sick, okay?
Yep. We'll keep topping you up with painkillers, don't want you to worry. We'll give you some nice fluids as well, make you feel better. We'll just push the rest of this through and see how you feel over the next 5 minutes. And then if you want some more painkillers, we'll give you some more painkillers, all right?
You in pain, John? Whereabouts in your neck and back? Let's draw some morphine up.
Despite paracetamol and fluids, the pain in John's neck and throat becomes unbearable, so Kerry draws up some morphine.
Right then, turn your wrist over for me. Right, happy to go with 5?
Yep.
Sorry, John?
Feel sick?
Although nausea can be a side effect of morphine, it can also be caused by inhaling the toxic gases in smoke.
How's that sickness? Has it gone away a little bit or is it still there? Yeah? All right. We'll keep that nearby. Just give you that bit of oxygen.
Is that pain a bit better, John? Yeah. How's your breathing?
Good now.
Yeah. So I just have a little look. Open your mouth. Okay. Still quite dry in there, aren't you? Blood pressure is 150/100.
Dr. Richard updates the trauma desk.
And treatment so far is IV access, 1 gram of IV paracetamol, 4 milligrams of IV ondansetron, 500 mils of normal saline, and 10 milligrams of IV morphine with some salbutamol nebulizers. ETA is approximately 20 minutes from now, over.
John's vital signs are improving, but there's still a risk of long-term lung damage as a result of breathing in so much smoke. But John has other things on his mind.
I hope my neighbours are okay.
Yeah, they're okay.
They're all right. They've been checked on, John.
I'm worried I got new shoes and keys.
Don't worry about that. Like, everyone will... I mean, I don't think you'll be able to go home for a couple of days anyways. It sounded like the Red Cross were going to come in and rehouse everyone while they sorted the fire out in the building and everything.
God, no. Oh, my God.
The main thing is everyone's safe, John. No one else is hurt. You're the only one who got hurt in it. No, don't worry. Accidents happen, don't they?
Arriving at the Queen Elizabeth Hospital in Birmingham, John will be taken through to the burns unit, where his breathing will be closely monitored.
There's that bowl in case you need it, all right?
Yeah. Thank you.
You're very welcome.
So we just hope you're feeling back to normal soon.
Yeah.
John was a really pleasant Patient, I feel really sorry for him. It sounds like he's been having quite a hard time with regards to his health and stuff. I only hope this is the end of his run of bad luck and things will kind of turn around and pick up from him from here. Hopefully he can spend his time on a ward and then be discharged in the next couple of days.
Thank you.
Can you feel me touching your foot at all? Yeah, you can feel me. Can you wiggle your toes at all? Yeah, you can. Good man.
In Walsall, critical care paramedics Mike Andrews and Ryan Ferris are treating 59-year-old Martin. He's crashed his motorbike, badly fracturing his ankle.
OK, take a deep breath for me.
Before they can move him, Mike needs to check for any other injuries.
You got any pains in your neck at all? No, not at all. Number one is priority for us is to get you inside in the wall. You raise that leg from there, your right leg? OK, all right. If you didn't have a problem with your other ankle, do you feel like you could move that? Do you feel like you've got good power in that leg? OK, all right. But you've got no pain in your hips at all? No pain in your arms, all right.
Satisfied Martin has no other serious injuries, Mike needs to get him onto the ambulance, but without causing any more damage to his ankle.
We just scoop him off the floor then, guys, do it quick as OK. Let's get you that side. What we'll do is log roll, just log roll him back that high. So it'll be ready, steady, then roll, ready, steady, roll. Slip it under, and then ready, steady, back. Lovely. Just push against my leg a bit. Let's get him in the wall.
Oh, yeah.
Let's do that, and then we'll do pain relief. We'll sort his foot out as well, and then we'll talk about plan where hospitals. OK.
Martin has lost a huge amount of soft tissue around the broken ankle, which could prevent it from healing properly.
Ready, steady, and lift. And we'll walk him over. Right, few little bumps, fella.
On board the ambulance, Mike and Ryan reassess the ankle fracture to decide what treatment is needed.
So you sort of went that way and you tried to avoid the car and then hit you, so it's your foot that took the brunt of it. Because your bike doesn't look that mangled, to be honest. I don't think we need to pull it, mate, or anything. Do you think I don't think it's dislocated enough to warrant it.
So from my perspective, although Paul says it's really warm, I don't think it's hugely dislocated to the point that we need to pull it. I think just a little bit of hemorrhage control because we're slightly dribbling.
Yeah.
Mike and Ryan decide the broken bone is in normal alignment but requires dressing and splinting.
Just some antibiotics, or some analgesia and then some antibiotics en route.
With such a large area of damaged tissue, there's a high risk of infection, so Mike immediately starts Martin on strong antibiotics.
So if 0 was no pain, 10's the worst pain you can imagine. Yeah, where would you score it at? 7 now. I need a 20mm syringe, tick. I need a red bung and a pink drawing up needle as well, please. Yeah, good, mate. Good to go, yeah.
It's an 18-mile journey to the Queen Elizabeth Hospital in Birmingham. En route, Mike travels with Martin to provide ongoing critical care.
Coamoxiclav augmented, 1.2 grams. So an open fracture. It's an antibiotic to cover it for that. Can I be a pain? Yeah. Can I have 2 of the water for injections as well, please? Yeah. How you feeling, Martin?
Entonox is an inhaled mixture of nitrous oxide and oxygen, more commonly known as gas and air.
Don't shove it all in, but just take it nice and steady with it.
While the ambulance crew injects Martin with antibiotics, Mike calls ahead to alert the trauma team.
6-2, hello. I've got a 59-year-old male. It's an RTC. He has an open, fractured, dislocated left ankle. He's got a good cap refill. He's got good sensation, but it's quite a lot of tissue loss and tissue damage.
I'll put you in.
The tissue loss around Martin's ankle is considerable. His recovery depends on it being able to grow back. If it can't, Martin is in danger of losing his foot.
How you feeling, Martin? Yeah?
Did you want the morphine?
Morphine I've done. So he's had Entonox, morphine, coamoxiclav.
Do you want him to have the paracetamol?
Yeah, do you reckon we could do with it?
Intravenous paracetamol, alongside the morphine, will help bring down his pain levels.
Right, that's going to run through pretty slowly anyway, just keep her eye on
Just
it.
keep that hand nice and still for her.
Not too far away now.
The team arrive at the Queen Elizabeth Hospital in Birmingham.
Martin, we're going to get you off now, mate. So when we take you in, I'm going to start talking to the docs and the team. There'll be quite a few people in there, it gets a bit chaotic.
So where are we going?
Straight into resus, mate.
Mike and the ambulance crew take Martin through to the emergency department, where the waiting orthopaedic team can start immediate treatment.
He's going to go through some imaging. The largest amount of work will be the soft tissue injury, so he's going to require some attention there. Maybe some plastic surgery involvement just to repair that ankle, really.
No, mate, good evening. Just checking in. It's myself and Adam Lowe. We're just checking kit. We're available if you need us.
It's a Monday night, and critical care paramedic Ian Locke and Dr. Adam Lowe are checking they have everything they need for a 12-hour night shift.
You never know what's going to happen. You know, people will get up to mischief. So, wait and see what the night brings, really.
An hour into their shift, and Control takes its 3,576th call of the day.
Ambulance.
Oh yeah, there's a child who's been run over by this. Very
Are they
responsive.
breathing?
Yeah.
Are they awake?
No, it's a child. He's been run over.
Stop there for me. Is their breathing noisy or abnormal?
It's noisy. Hello, darling.
An ambulance is already en route to the incident, but with a child's life in danger, Dr. Adam and Ian are also immediately dispatched.
So we're going to Brierley Hill to a 10-year-old who's been on their push bike hit by a bus by the sounds of it.
The boy has been reported as conscious and breathing, but there are no further details.
This is a high-risk incident for major trauma, so anaesthetic on the roadside if they need it, splinting and stopping bleeding, blood transfusion if they need it.
The potential for serious injury is considerable.
Updated assignment.
Arriving at the location, Dr. Adam and Ian are met by the tactical incident commander, who briefs them on what he's discovered so far.
Body count was cycling alongside the bike and then somehow gone underneath. Okay. It's been dragged off a couple of metres, but what we've gathered is it's fallen off sideways, so it's not gone underneath the bus. Okay. Patient pain, some abdomen. Okay.
The boy was coming out of a cul-de-sac on his bike when he collided with the bus. Passers-by say he was initially knocked unconscious, but that he didn't go under the wheels.
Is he on the back of the
Yeah, he's on the back of the
ambulance?
ambulance. Initially, when he got there, he was kind of up and trying to move away, but he's like agitated. He got some distension to his umbilicus region, and he's complaining of left pain in his proximal femur. But there doesn't seem to be any distension. All of his clothes are cut off except for his pants.
Hi guys. Hi Tyler, my name's Adam. Right, I'm doctor with the ambulance service. Is it all right if we come and have a look at you? Is that okay?
10-year-old Tyler wasn't wearing a helmet and has cuts and bruising to his head.
Yeah, a bit tacky, can I have it?
Tachy or tachycardic means a fast heart rate, a sign that Tyler could be bleeding internally.
How about these legs? How do they feel? Can you lift this leg up as well, Tyler? Okay. Can you bring both legs up together? Does that cause you any pain? Okay, all right.
In Warwickshire, Dr. Michael Bright and his team have just arrived on scene with a patient who is suffering a life-threatening anaphylactic reaction. 29-year-old Helen was working at her desk when a colleague opened a bag of nuts next to her.
What kind of symptoms did you have initially?
I couldn't really breathe.
Okay.
Struggling to breathe, and then I was struggling to swallow.
Yeah, okay. And these are your usual anaphylactic symptoms? Yeah. And when did you use your EpiPen?
About 5 minutes ago.
5 minutes ago, okay.
Helen carries an EpiPen everywhere she goes. This is a syringe that delivers adrenaline straight into her bloodstream.
And do you think you felt any effects of the adrenaline at the moment? Yes. Yeah. You look like you've got the adrenaline shakes.
I've got it.
Do you feel like your anaphylactic symptoms are improving?
My breathing's better.
Yeah.
Adrenaline immediately reduces swelling in the throat, making breathing easier. But it can also cause a surge in energy that leads to shaking.
So your observations look okay at the moment. In fact, they're looking higher because you've had the adrenaline. And you know, clearly have had the adrenaline.
Yep.
Yeah, I'm sure you can feel the adrenaline. I think it's a case of waiting to see. As you know, with anaphylaxis, it'll either start to get a little bit better or it'll start to get a little bit worse. We're just waiting for a backup ambulance and then we'll take it from there. All right.
An estimated 20 deaths from anaphylaxis are reported each year in the UK. And when a bad reaction turns life-threatening, it's vital to get medical help fast.
You're a bit in the middle of nowhere here as well. Not the best place to have an anaphylactic reaction.
Generally, I'm quite well behaved. Sometimes other people get in the way.
Righty-ho. Which hand do you normally prefer to have a cannula in if you're having one?
Oh, can I don't really care. She's not very good with needles.
She's not very good with needles. I'm sure you know better than we do how your anaphylaxis goes.
Yeah.
So we will just get all this in place just in case you need to have some more adrenaline.
Dr. Michael inserts a cannula into Helen's arm so adrenaline can be given quickly, if it's needed.
Sharp scratch coming up, okay? You probably just need a trip up to ED just to be watched. Because you know with anaphylaxis you get this kind of biphasic reaction. Could come back in about half an hour, 40 minutes. You're in the middle of nowhere, you know, realistically.
Anaphylaxis often begins minutes after exposure to the problem food. But some people have a second wave of a more severe reaction that can appear hours after the initial symptoms subside.
There we go.
Dr. Michael updates the ambulance crew on Helen's condition.
Known anaphylaxis, had an episode, she's had a PENS, allergy to nuts. Previous episodes biphasic, so she's had some times where she's had a pen and it's got a little bit worse. Numbers are all okay at the moment. I'm not particularly concerned, but obviously probably needs to go up for a little bit of observation for the next couple of hours.
Not needing any further adrenaline doses now?
Not at the moment. We've done the basics, got a cannula in situ.
Marvellous. Brilliant, thank you.
So you're going to get the full service. They're going to pop you on the bed.
Helen seems fine now, but having had one attack today, Dr. Michael knows the next one could be much worse. She needs to go to hospital for observation.
Just pop some ECG leads onto your chest, okay? Just to keep an eye on your heart rate. Was it just nuts in the office? Are you quite...
Someone brought a giant bag of mixed nuts into the office, even though it's a nut-free office.
Yeah. Was you in close contact with them?
She was sitting next to me.
Oh, she was?
That was good fun.
But any point on the way in, it feels like your throat even mildly starting to swell again, let me know straight away and I can start drawing some up. Okay.
Dr. Michael is happy to leave Helen in the care of the ambulance crew, who will keep her under observation en route to hospital.
We're actually a bit of a way out of the city now. This is a farm area. If this patient didn't have her EpiPen with her and she developed the symptoms of anaphylaxis, then potentially it could have been life-threatening.
What are you thinking in terms of triage?
In Brierley Hill, Dr. Adam Lowe and critical care paramedic Ian Locke are treating 10-year-old Tyler. He was riding his bike when he collided with a bus.
Tyler, your mum's just outside, okay? All right. She knows that you're nice and safe. She knows that you're doing really well, okay? Is it all right if I pop a little blanket over you just to keep you warm?
Get you a bit warm, buddy.
All right.
There you go. You've been very brave, haven't you?
I mean, he's airway intact, his eyes open, he's got moving all four limbs, a bit of tenderness there, but doesn't feel particularly guarded or rigid. Pain in the left knee.
Tyler didn't fall under the wheels, but witnesses say he was dragged along for a few meters and was knocked unconscious.
But he's been drugged up. I still feel...
You want to what, sorry, Tyler? You off to Mum?
Yeah.
Okay. Is it Anna? Is it? Are you Tyler's mum?
Yeah, and that's his dad. That's his dad. I've had to phone him from work because he does quite loads hours.
Okay.
Tyler's mum Anna was at home when she got the call every parent dreads. By the time she arrived, her son was being treated in the back of the ambulance.
I'm Adam, I'm the doctor with the ambulance. Okay, Tyler's okay, he's conscious, he's talking to us, he's asking after you, okay, which is a good sign, yeah.
I just didn't see him thought he's dead.
He definitely isn't, okay.
Right.
He's doing really well, okay. I just need to know a little bit more about him so I can make a decision about what the best hospital is for him to go to, okay. Does he have asthma?
No.
Any problems with his breathing?
No.
And has he had any medication today?
No.
On board the ambulance, Ian is monitoring Tyler's condition.
How old are you, Tyler? You're 10. Do you know when your birthday is? In March. Okay, all right.
By asking questions, Ian is looking for signs of confusion that could point to a brain injury.
Yeah, I know, mate. Should we try and get you some medicine to take that pain away?
Yeah.
Yeah, okay, mate. Let's try and have a look at that as well.
Outside, Dr. Adam takes another look at the bus to try and work out exactly what happened.
Whilst we can see the back, what's been dragged. Here.
Okay.
So we clipped him from here.
Okay. Is that your head, buddy?
My head.
Whereabouts in your head?
Is it where I'm holding?
Yeah.
Is that better now?
Tyler's head is completely immobilised to protect his spine on the journey to hospital.
You want to go to sleep? You can close your eyes if you want, Tyler. What we might do is just keep asking you questions, though, OK? Good man. Good man. You feel a bit sick? All right. You going to be sick? Should we get you a little bowl?
Before they set off, Dr. Adam checks Tyler's abdomen once more, looking for signs of bruising or internal bleeding.
We'll go BCH. He looks fine, his heart rate's coming down. He's just a little bit drowsy now, feeling a bit sick. So BCH based on mechanism.
As Dr. Adam can't rule out a serious head injury, he decides to take Tyler to Birmingham Children's Hospital, the region's paediatric major trauma centre.
He's doing fine. We're going to take him to the Children's Hospital. It'd be helpful for one of you to come just help. As I say, it'll be a case of them checking him over.
Tyler's mum will drive to hospital. But before they all set off, Ian updates control.
No, we're going to be conveying this patient on balance. We'd rather get him checked up at BCH.
Thanks very much, and I'll pass the alert now for you.
The hospital is a 20-minute drive away. Adam travels with Tyler to carefully monitor his vital signs.
Tyler? You okay? Yeah, good lad. I can't see any evidence of a tyre going over him, thankfully, because that's normally what causes the damage, so I think he's been very lucky, really. Tyler, we're at the hospital now, okay?
Waiting for him when he arrives is his mum.
Are you all right to get him checked in with Mum? Is that all right? So we'll just take him in. They'll obviously check him over. You just need to get him registered with his name, date of birth and address and so on, OK?
Tyler will be seen by the trauma team to make sure he has no internal injuries that aren't obvious.
Well done, Tyler, OK. He wasn't wearing a helmet, so he was lucky he didn't hit his head badly on the pavement. The glance below knocking him off his bike, and then a bit of a combination of him hitting the side of the bus and then hitting the ground. So hopefully he's lucky and hasn't done himself any major injuries.